Hello, the Logical Indian community members. I'm Ritika Aggarwal, consultant psychologist at Jaslok Hospital and Research Center in Mumbai. Today we're here to talk about World Mental Health Day. It was observed for the first time on 10th October 1992. This year's theme is Mental Health for All, Greater Investment, Greater Access. World Mental Health Day aims to unify and raise awareness in the global communities about critical mental health issues and agendas, and to take action to create lasting change. Now let's talk about why it's important. The WHO estimated in 2015 that 1 in 5 Indians suffer from depression in their lifetime. That's a huge number, that's about 20% of Indians. In 2016, suicide was the leading cause of death in India among young people aged 15 to 39 years. In 2018, the WHO stated that every 40 seconds, someone dies by suicide, and that's about 8 lakh people per year. In 2019, a study found that 42.5% of Indians in corporate setups are facing either anxiety or depression. That's almost every second employee. Again, it's a huge number. Now, against this already dire mental health circumstance, we have the current COVID-19 pandemic, which is giving rise to further mental health issues. What is the importance of seeking mental health today? Depression and anxiety can affect day-to-day functioning, making it difficult for us to cope and be productive members of society. It can also result in social isolation from friends, family, and reduce our support system. It's essential for long-term well-being, physical and mental. If one doesn't seek help, we may open ourselves up to more severe concerns, which can disrupt our relationships, harm work performance or school performance depending on our age. It can increase the risk of substance abuse and open us up to a host of physical disorders such as diabetes, etc. Now, how do we deal with this mental health issue during a pandemic? Let's start with what are the issues that we are facing right now. One is the stress and anxiety has gone up during this period. As we don't know what to expect, there's a fear of the unknown. In addition, most of us are working from home, which again leads to its own issues of role blurring, work-life imbalance, difficulty finding time for oneself, and fatigue. Now, how do we deal with these basic concerns? First, set clear boundaries for home and work. So when you find that you're working through the day, you have kids coming in, spouse, in-laws, make sure everyone knows what these boundaries are. Create a schedule for yourself, and if possible, share it with the rest of the family and at work so everyone knows when you're busy, when you're free, and what time is your time. Construct transitions into and out of work. Earlier it was maybe your travel to work, travel back home. Now it could simply be just packing up your desk and keeping it away, clearing up your workspace, planning for the day, having a bath and getting ready to sit down to work, clothes being different for work and relaxation. Set up a workstation. So wherever you set up your workstation, try and avoid the bed. Try and make sure that you have it in a place that's quiet, that has minimal distractions, and where you're comfortable working. So it needs to be something that does not affect your back or other aspects of your physical well-being. Maintain a virtual network with your colleagues. So for example, maybe have lunch with them or a coffee with them virtually as you would while you were at work. So this allows you to feel that support system and the feeling that you're not alone during this pandemic. You're not the only one dealing with this issue. Reframe your thoughts. Focus on what you can control. So a lot of us are focused on this pandemic has caused this issue for me. But maybe if we reframe it to, oh, I got to spend time with my family. I have been busier, but I learned other skills. So it's important for us to reframe our thoughts so that we don't focus on what we can't control and that's out of our hands. Focus on self-care. So make sure you have adequate sleep, 8 to 10 hours. For this, maybe you can try and do something relaxing before bed. Make sure you don't work on your bed. Try and avoid that, as I said earlier, because your mind might get confused in terms of whether it's space for work or for relaxation. Make sure you have adequate nutritious food. Exercise about 30 minutes a day. And find time to recharge. Now, when I say recharge, try and do things that you enjoy doing, even if it's just 5 minutes in the day that you manage, but try. Practice mindfulness, practice gratitude. Gratitude is the small things. We tend to focus on the bigger things in life, maybe a promotion, maybe a birth, but try and focus on simple things like someone saying thank you, maybe someone calling you up to check in on you. So try and focus on what you have right now. You can even try keeping a gratitude jar at home or a journal for yourself. A jar maybe could be in your central area of the drawing room. You can work on it as a family together. Again, this allows you to connect with the rest of the family outside of work related things or chores that you're doing. Try and do deep breathing exercises. So for example, you can try the 4-7-8 technique, which is breathe in for 4 counts, hold for 7 counts, and exhale for 8 counts. Now when you do this, you'll find that you're completely focused on the present. You're not thinking about, oh, I have this work to do, I have that work to do. You're only focused on your breath. Now when you focus on your breath, that's the easiest form of relaxation that you can do. And it's a good way of relaxing the system also, the physical system. And most important, if you feel that you're finding it difficult to cope, if you feel that you're not functioning as well as you normally do, please do seek help from a psychologist. Today there's a whole range of options available out there, irrespective of the cost. It does not mean you have to spend a lot of money, but please do go out and seek help. Thank you.